Thank you. So I wanted to say, first of all, that it's really my pleasure and my honor to participate in this really important webinar. And I want to thank you, Sarah, for being so proactive and really going through all the necessary steps to put this wonderful conference by webinar together. And without further ado, because I know we have a lot of really good information, I want to begin. I'm looking forward to learning something from our other fabulous presenters as well. I'd like to start with a brief history of ART, which is assisted reproductive technologies. And my slide is right here. So whether or not people realize it, the first recorded traditional surrogacy is described in the Bible. Sarah and Abraham were married. Sarah was barren, and she gave Abraham her maid, Hagar, who then conceived with Abraham. And when the baby was born, it was born onto Sarah's lap, and that was the first recorded traditional surrogacy and adoption. The first in vitro fertilization baby is, of course, baby Louise Brown. She was born in 1978 in Great Britain. Doctors Edwards and Steptoe received the Nobel Prize very recently for it. Unfortunately, Dr. Steptoe had already passed away, and Dr. Edwards is believed to have had dementia and not actually appreciated having received the award. The first egg donation baby was in 1984, followed by 1 year later the first surrogacy baby. Nowadays, in vitro fertilization and assisted reproductive technologies is quite common. About 5 million babies have been born worldwide, and 58,000 babies or so are born annually in the United States. Surrogacy is a in vitro fertilization type of cycle when the surrogate is a woman who carries a pregnancy and is known to be expected to relinquish the baby to the intended parents. These embryos may be created from the eggs of the intended mother, from a different woman altogether, an egg donor, or using the surrogate's own eggs. Egg donation is another type of in vitro fertilization cycle wherein the eggs from one woman, who is the donor, are used to conceive a baby for someone else. The woman who receives the embryos may either be a surrogate, in this case would be a gestational surrogate, or the intended mother. Neither one of these women will have a genetic linkage to the child, though of course the egg donor is genetically related to the child. And up above in the corner we see a picture of a gorgeous egg. In vitro fertilization overall is a cycle where we first stimulate the ovary with injections. The eggs are retrieved by an outpatient vaginal procedure. The eggs are fertilized, embryos are created in vitro, meaning in the dish, in the laboratory, and an embryo or embryos are returned into the uterus, called an embryo transfer. We always hope to have additional embryos of good quality, and those can be frozen or cryopreserved. Overall, IVF and ART appears to be very safe for mom and baby. We have over 30 years of experience, and we have second generation already, so people who underwent in vitro fertilization and then had children have now become grandparents. So we see that there's one more generation and things seem to be fine. Baby Louise Brown, the first IVF baby, actually spontaneously conceived and delivered a gorgeous baby several years ago. There's, of course, always ongoing research which continues, especially regarding the more uncommon and rare diseases such as autism and other such conditions. There is a slight increase in cesarean section rates, The IVF babies appear to be slightly smaller than spontaneously conceived babies, though they're in the normal range in weight, and delivery appears to be earlier. When we optimize IVF, both the physician and the whole team are important, and part of that team is actually the patient herself, you. It is important to choose a reproductive endocrinologist, such as myself, or anyone who specializes in this field, and to look into their experience, into their training, meaning are they board certified, have they had specific fertility training, do they have clinical experience, have they been doing this a while, do they have good success rates. These are, I believe, the standard questions. But once you have found a group of people who potentially you would like to work with, it is important that you relate well with the physician, because this is a very personal and special transition in the life of a family, and it's important that the physician and the patient or the couple really feel that they are on board with each other in terms of what to do, how to do it, what is acceptable, what is not acceptable, what's right for you, what is not right for you. I believe it is important that the reproductive endocrinologist will synergize with complementary medicine and health care. This means the nutritionist, the acupuncturist, the psychologist, mind-body specialist, etc. Each couple, each patient is different, and it is really important to maximize their overall health so that the success of the cycle can be ensured as much as possible. And attention to detail is always very important. The IVF or ART laboratory is of paramount importance. One needs to know information about the personnel, the training and experience and success rates. It's important to also find out about the technological capabilities of the laboratory. Different laboratories, while all being called IVF laboratories, don't all offer the same thing. When one says, I can freeze your embryos, how? A vitrification process is significantly more successful than the old slow freeze, and this can be quite important and may make the difference in the future when using frozen embryos in terms of success. However, this method is very, very expensive, and to bring this to the laboratory requires the laboratory to invest approximately $100,000, and many labs cannot do so. So information about the actual level of expertise in the lab is very important. We're going to hear from Susan Katzman regarding the paramount topic of the legal aspects of egg donation and surrogacy. And I cannot say enough about how important this is, even if people are using family members or best friends as their surrogates or donors. Complementary health care, as I said above, I think is very important to maximize the outcome. As we said, in vitro fertilization is very safe. As a matter of fact, the American Society of Reproductive Medicine has deemed that egg freezing by vitrification specifically is no longer experimental. Nonetheless, it's still very important that we screen our donors and surrogates very carefully. The FDA actually is involved in this process, and the screening involves a history, an extensive history, which includes a medical history, a long questionnaire about risk factors, which is posed by the FDA, a gynecological exam, a pelvic ultrasound, and if necessary, an evaluation of the uterus by a special X-ray called an HSG or sonohysterography. Laboratory testing is extensive. There's the general well-woman testing, there's infectious disease screening, endocrinologic evaluation, as well as an extensive genetic evaluation for the donor. Especially for the surrogate and sometimes for the donor, we need to test the part. These are a few very beautiful pictures. We start on the left and we see a sperm penetrating an egg. We then see a fertilized egg, which is what we say is a zygote. Next, we see a beautiful flower-like third-day embryo, an 8-cell embryo. And finally, on the bottom, we see two gorgeous blastocysts, which are getting ready in the right environment to implant. We can never forget the miracle of reproduction. And here we see a baby growing in its amniotic sac. And I wanted to thank you for your attention and proceed with questions. I'm going to turn over now to a page where you can see me. Thank you so much. Can you see me?
Yes.
Great. Does anyone have any questions? Oh, I guess questions we're going to do at the end, correct?
Yes, we'll do the questions at the
Okay.
end. Yeah.
So then I'll turn this back to you, Sarah.
Thank you so much, Dr. Ben-Ozer, for your fantastic presentation, very, very illuminating, and I like how you explained it so clearly